Hey everyone, my name is Dr. Matt Palmer. I want to talk about a condition today that affects many people, but it is not often discussed, and that's pelvic organ prolapse. Let's break it down together. We're going to talk about what it is, what causes pelvic organ prolapse, how it's diagnosed, and what treatment options are available to treat it. Pelvic organ prolapse happens when the connective tissues and muscles of the pelvic floor weaken. When we look at this cross-sectional model, we can see that the bladder typically sits above the vaginal area and the rectum typically runs below the vaginal area. When prolapse occurs, you can see a dropping of the bladder down into the vagina or a bulging up of the rectum into the vagina. And both of these things create different symptoms and dysfunctions for a person. So what causes pelvic prolapse? Factors such as childbirth, heavy lifting, chronic constipation, menopause, can all contribute to the weakening of the pelvic floor. Diagnosing pelvic organ prolapse starts with a visit to your healthcare provider. They'll ask you questions about symptoms such as a feeling of pressure in the vagina, difficulty emptying your bladder or bowels, and they'll be able to perform a physical exam to further support the diagnosis. Now let's talk about treatment of pelvic organ prolapse. Mild cases of prolapse might be treatable with lifestyle changes or pelvic floor exercises. A pelvic floor physical therapist can guide you through a treatment plan to help treat mild prolapse. There's a variety of surgical options that can help re-support the prolapse tissues and be corrective for long-term prolapse repair. Remember, pelvic organ prolapse is common and treatable. If you're experiencing symptoms related to prolapse, don't hesitate to reach out to your doctor. Taking that first step can make a big difference in your quality of life.